Si Diyos masi. Buenas and half a day. Todos hamzu. Many of God's blessings to all of you here this Friday evening. This informational briefing by the Committee on Human Resources is called to order. It is 5:56 p.m. in the evening. For the record, and in accordance with 5 GCA Chapter 8, Subsection 8107, public hearing notices were sent out on Friday, February 14th at 2020, and this is adhering to the 5-day notice. And a second public hearing notice was sent out on Wednesday, February 19, for the 48 hours prior notice. In addition, ladies and gentlemen, this hearing was noticed on the legislature's website, and that was www.guamlegislature.com. Written testimonies may be submitted by emailing them to speaker@guamlegislature.org, or you may hand deliver any testimony to our office at 163 Chalan Santo Papa, Hagåtña, Guam, 96910. Joining me here this evening, ladies and gentlemen, are my colleagues present, and I will start from my far left, as I'm left-handed. Senator Pito Terlahi, thank you for joining us. Senator Regine Bisco-Lee, Senator March Taitino, who's my vice chair, si Diyos masi, our legislative secretary, Senator Amanda Shelton. I think we have a minority leader, Senator Tello Taitigui. Thank you for being here this evening. I had called this hearing this evening, ladies and gentlemen, because I had a handful of constituents who had reached out to our office regarding the issues that they had faced with their current insurance plan. As constituents came our way, we had reached out to Aetna in order to address the individual health concerns. Recently, I've been advised that Aetna International has taken steps to address what I'd like to call growing pains. And I had called them here to share with the public pertinent information regarding our health insurance plan. As this is an informational hearing, I had called on the subject matter experts to present to us today. This includes the following individuals, and as I call your name, you may go ahead and come up and have a seat on the table here. And before I do that, I'd also like to recognize some of the leaders in the community that are here. I see Mayor Paul McDonald from Magana Heights. Si Diyos masi for being here. Mr. Byrne, who is the Director of the Department of Administration. And to all of you here, Si Diyos masi, Mr. Kaswani from the HRA. Mayor Rudy Paco, I thought I saw him, he's right there. Thank you so much for being here this evening, because I know that a lot of the concerns have come your way also through the mayor's office. So if I can have Mr. Ed Byrne, please, the Director of the Department of Administration, please join us up here on the table this evening. Mr. Hassan Kreibani, I hope I didn't murder that name, your name, sorry. He is the International Account Director for Aetna International. Mr. Frank P. Ariola, he is now the Senior Client Service Manager for Aetna International. Please join us. Okay, thank you very much. Given that this is an informational hearing, briefing, I am requesting that my colleagues here submit questions that they may have of the panel to my office, and we will transmit any question we receive to Aetna International. For the record, and to the listening audience out there, Aetna International has a Guam office. They are in the Eulalie Center, and it's right here on the first floor, if I'm not mistaken, right? First floor, Eulalie is where your main office is. Aetna will then answer these questions and submit them in writing to our office, and we are doing this in an effort to protect the private patient information that may come up. And in an effort to further protect the privacy of the individual's public health information, individuals who have concern with their health plan should address them with their insurance provider. As a courtesy to those who are here, I have requested that the representative of Aetna International be here to answer any general questions you may have. If the information requested requires you to access your patient files, Aetna International representatives are stationed right outside to schedule appointments with the appropriate individuals. Individuals who choose to submit information to the Committee on Human Resources regarding their concerns, ladies and gentlemen, I will tell you that my staff is also available to receive these concerns. We have forms available that you can fill out and submit to my office. My office is located right outside the public hearing room, to my left, to your right, where my staff is available to assist with intake of information. And I just want to again thank everybody for being here. I know that some of the folks from the university are also here, but more importantly, because Aetna International is the government's provider at this time, we will open the floor for your presentation. And if there's any other questions, please don't hesitate to work with our staff. We have Amanda, who's sitting at the table, and we also have our communications director, Mr. Sharat Bawani, who's also here, and our office is also staffed with members in there if you'd like to take the time in private to write your concerns. So at this time, I open the floor to Aetna, or Mr. Byrne, would it be okay if we yield to Aetna first before I have the government speak?
Yes, thank you, Speaker.
Thank you, Mr. Byrne.
Sijus Masi, Madam Speaker, Senator Tello Taitui, Secretary Amanda Shelton, Senator Kelly Marsh Taitano, Senator Regina Bisco Lee, and Senator Pito Terlahi. Thank you for this opportunity, and I'm going to read our script. Thank you for inviting us to present at this informational briefing. We will take you through our update on the service we are providing and the enhancements we have put in place to improve the customer experience for Aetna members. In line with the speaker's direction, we will not be taking questions during the briefing, but are very happy to respond to individual questions submitted in writing to the speaker after the meeting. Again, my name is Frank Perez-Ariola. I am the Senior Client Service Manager here at Guam. I am the Guam Manager for Aetna International. To my left is Hassan Kraybani. He's a director for Aetna International, and he will actually be doing the heavy lifting with the presentation.
Thank you, and thank you again for this opportunity. It's very exciting to be here with you regarding this very important subject that pertains and affects many GovGuam employees, retirees, their families, for receiving care here in Guam and off island. So a little bit about the journey that I'm going to take you through today is really going to be beginning from the effective date of October 1, 2019, and the challenges and solutions that were put in place up until present day. So we'll be kind of just taking you through that journey from October, November, December, and to provide more additional information on some of the challenges that our members also faced during that time as well. We can skip slide. One more. Thank you. So at International, we have a dedicated support team of right around 75 people, if not more, 42 of which are member service representatives who are assigned to supporting GovGuam members who need support in finding providers, inquiries pertaining to their claims, and many other services, which we'll talk more into later in this presentation. In addition, it includes our account management team, our Aetna Guam office, our Aetna Pharmacy and CVS Health, billing, clinical and case management, eligibility, our network, and operations teams. Skip. What's most important with that International is members are at the center of everything we do. We strive in being local in everywhere we serve, and also making healthcare simple, which is also very difficult to accomplish when it's very personal in nature. We also strive in leading the change and improving our members' health. Our clinical team works very closely with supporting case management for members who are receiving care here on island, but also also members who need to travel off island, and maybe whether it's air ambulance to the Philippines, or to Hawaii, or to the States. Skip. So I'm going to start you here today with open enrollment. I think many are aware of the significant efforts that took place during end of September, early October, to educate Gov Guam employees and retirees, one, that open enrollment's taking place and there's a change of insurance, but also, more importantly, understanding what their health plans offerings are through the government program, and then helping them register and sign up. We held over 30 open enrollment events and assisted over 6,000 people during that time. We also hired 14 staff members here in Guam and in the Philippines to support the membership receiving care here, and also helping them through that transition. We completed the build out of our office in the Hulali Center, currently Suite 113. And we also prepared our stateside network of over 1 million providers to receive Gov Guam members. Next slide. Open enrollment, unfortunately, was not the easiest process, as many members had to endure. Standard big business practice would state that during a transition from one insurance to another, an electronic enrollment file would be provided to the new insurance company. An electronic enrollment file provides information about not only who the subscribers are, but also their dependents who are enrolled, which plans they're enrolled in. It would allow for a seamless rollover into the new insurer's system. That would have resulted in significant time savings and administrative burden on our members, and also for government of Guam. As a result, unfortunately, that request to receive that file from the previous insurers was declined, and we were not able to receive an enrollment file to then just put into our system. That created significant challenges, especially since many of Gov Guam membership is dispersed. Some are here on island, some are off island, some are receiving, maybe they're hospitalized or inpatient here or off island, or on leave. Sharing this information minimizes disruption, the administrative burden for both the client and our members. So we really tried to get that information to make it as easy as possible for our members, but because we did not get that file, we had to result into our solution. We had to result to receiving enrollment forms. So what that means is each of our members had to complete an enrollment form in order to be enrolled in the program. We partnered with many of the agencies to collect their payroll deduction information, to identify those members, those employees who were enrolled as maybe as Class 1, employee only, to try and minimize or expedite enrollment into our system as quickly as possible. We also solicited, partnered with facilities, including St. Luke's and Medical City and GMH, to identify those members who are inpatient receiving care, because we also needed to collect their enrollment forms. So we had staff in many of these facilities, going around identifying Gov Guam members and ensuring that we were and supported them in completing their application so that they can be enrolled in the program. As of October 19th, Aetna processed a total of 24,506 members into our system. About 13,000 of them were subscribers. So a pretty significant number of enrollment paper application forms that we had to manually input into the system. Next slide. Having the results in paper enrollment leads to a lot of time and many downstream effects. One being the time frame. Originally, the open enrollment was slated to close around September 30th. That would have been ideal. We would have had everyone enrolled prior to October 1, 2019, which is the coverage effective date of the GovGuam Health Plan. But because we had a result in paper, due to the volume of membership and the need to collect enrollment forms, extending open enrollment beyond October 1 was unavoidable. We really wanted to extend open enrollment past October 1 because we needed to make sure that we collected as many enrollment applications as possible, that we reached out to all of membership as effectively as possible, because we did not want them to miss the opportunity to be on the plan. The risk is, by doing so, coverage begins October 1, so we don't have all enrollment into the system on the start of the health plan. There's a lot of members who need to receive care, who have appointments scheduled, prescription refills that are needed at that time. And so the solution was, we did extend open enrollment until October 12th. We worked directly with the provider community to ensure continuation of care was adhered to for GovGuam members. And we identified inpatient members on and off island that needed help completing enrollment applications and obtained ID numbers for those needing immediate care and or prescription drugs. We really encouraged during many the over 30 presentations for members to let us know if they had care scheduled. We were not telling them to cancel appointments. We wanted them to maintain those appointments. And we were working with each of the facilities as well to ensure to them that our GovGuam members are covered effective 10/1. And we tried to get as many as we could into the system as quickly as possible upon receiving their enrollment application to avoid any disruption in care. Next slide. So as a result of having to, so the challenge here is paper, ID cards. Paper enrollment ultimately led to a downstream impact, delaying the print and distribution of ID cards. We originally hoped, in a perfect world, we would have distributed ID cards much sooner. ID cards were not distributed until December, which was unfortunate. However, prior to printing and distributing ID cards, it was of utmost importance that our enrollment was accurate as possible before printing. We tried our best to, and partnered with many of the agencies to audit their enrollment to ensure that we had everyone enrolled. We wanted to make sure that when ID cards were printed and distributed, that they were as accurate as they could be at that time. We encourage our members, if they identify any misspellings because of the paper enrollment, we had, sometimes handwriting is difficult to read. But we do encourage our members, if you noticed any errors on your ID card, to please let our office know, and we can support you with getting that corrected and a new ID card provided to you. We worked with healthcare providers to ensure the gold form. So the enrollment application was a 4-piece form. It was your main copy plus 3 carbon copies, the last one being the gold form, which was the member's copy. So we worked with healthcare providers to ensure the gold form would be accepted as proof of coverage for medical appointments, because many members, when we enrolled them, they did not have their ID cards to present to providers. We also partnered with each of the, so I mentioned that we partnered with each of the agencies for audit enrollment, and it continues to support reconciling enrollment with each of the agencies involved. Next slide. Pharmacy. So we established contracts with 18 pharmacies on island. I think there may be more now. Many of them are listed here on this slide. Pharmacy is a big one, right? Because many of our members who needed to receive their prescriptions, especially during open enrollment, were not able to. So we had to quickly get them enrolled and ensure that they were in the system so the pharmacies can process their benefits at time of fill. Next slide. So the challenge here is, Similar to enrollment files, during a large transition, you would also request a prescription data file. And a prescription data file is a listing of drugs that members are taking and identifying those who have already satisfied step therapy and other pre-authorizations. Unfortunately, the RX data file request was declined as well. So we were unable to know, as we were enrolling members who are taking drugs, if they're taking a drug that requires step therapy, whether or not they've already satisfied step therapy. We certainly didn't want any of our members to go through that again, right? I know some members were concerned, wait, do I have to do this all over again? I've already been through it. And that was a significant disruption to our members, especially considering how many fill prescriptions. This is a private file shared from one pharmacy benefit manager to another. So I just want to make sure that's also very clear, is that this RX data file is not shared with the client, it's not shared with anyone else except the two pharmacy benefit managers. So understanding the difficulties that our members were facing, and so what Aetna decided to do was waive step therapy from the prescription drug program. Because we did not receive the file, the best thing we thought to do was just get rid of the requirement to require step therapy, and through time build our own list. So through end of year 2019, Aetna compiled its own prescription file based on member utilization. For lack of better words, grandfathering members taking drugs that require step therapy as having satisfied this request. Certain insulins that are not covered under the Aetna's formulary were covered during this transition in an effort to minimize disruption. So we also noticed that certain members were taking insulin that was not under our formulary benefit, but was on the previous. And in an effort to avoid any disruption, we decided to cover those also. In addition to pharmacy changes that we had made, we also decided that we would cover 100% for insulin and diabetic supplies effective 10/1 to avoid any disruption in other types of insulins that members may be taking as well. But also just the change in formulary from one carrier to another can have disruption to membership. And given all that members were already going through during that time, we figured that we would help accommodate them. I'd also like to note that as you review formularies between two insurance carriers, because a drug is excluded on a formulary, it does not mean that you cannot obtain the drug. So providers are able to submit for medical exception based on medical necessity if a member needs to take a drug that does not appear on our formulary listing. And with approval, members would be able to continue to receive those drugs at the non-preferred brand benefit level. Next slide. Claim submissions. So in September, we held a pretty significant briefing, providing informational session, providing education to many of the providers. We invited many of them to, I forget which hotel it was. Lotte. It was a great opportunity for many of them to come ask questions. We provided support with understanding how to do business with Aetna. We set up monthly meetings with many of the larger clinics on island to discuss what's working well and where are some of the challenges that need to be improved. And we signed many providers up for EFT, electronic funds transfer, for faster payment turnarounds. We also continue to work with our partner NetCare to ensure best possible network discounts for our members while maintaining provider satisfaction. We work very closely with NetCare to provide the provider network here on Guam. And it's been a great relationship as well for many years now. Next slide. So provider claim submissions. Some of the challenges that we observed since October 1 to present day are paper claim submissions by providers. We've also observed that many of them were signed up for check reimbursement. And these two together create a significant delay for turnaround time for if a member submitting a claim by mail to Aetna, that takes time. But then also once we collect, receive, and process it, we send a check back to them. That also takes more time. We also recognize that codes were used for certain claims at times needed to be reviewed and corrected. So the solution is Aetna has continued to engage the provider community with better understanding Aetna's coverage and claim submission methods to improve turnaround time. Also, Aetna continues to provide support for claims that may be pended due to certain codes that do not specify diagnosis that causes a delay in the completion of the claim. Aetna encourages providers to submit claims electronically, and we also encourage providers to set up for electronic funds transfer so that they're paid more quickly when the claim is processed. Next slide. So here I'm sharing just some stats to share with you regarding provider claim submissions and what's been, kind of how many have we processed. So as of February 19th, we processed 75,775 total claims that were completely processed up until February 19th. This does not include pending claims. 448 claims as of that same date are less than 5 days old, and 266 claims are less than 3 days old. 65% on average percent of claims are auto-adjudicated. Auto-adjudication means that when we receive the claim, it flows right through our system. No one has to touch it. Right? The system handles the claim. That's a good number. Of course, we would like that number to be higher, right? We always strive for higher auto-adjudication, right? Because it means that the claims are being processed quickly. However, some certain programs within the health plan require manual intervention, so we'll continue to monitor the auto-adjudication. Also, on average, claim turnaround time is 8 days. So for a claim coming to Aetna being received, let's say a clean claim that's not pended for any issues is processed and paid within 8 days. And Guam law requires claims to be paid within 45 days. Next slide. So here I'm going to share a little bit about the member claim submission process and some of the challenges that members have experienced. Paper claim submission, right? Members submitting claims to Aetna by paper also takes time, right, for Aetna to receive it, the natural delay due to mail. And also on that claim form, if they sign up for a check reimbursement, also takes time for Aetna to mail the check back to the member and just the natural delay due to mail. And then also very important, I'll speak more to it shortly, is understanding the explanation of benefit form. So our Aetna Guam team continues to provide support with helping members understand the claim process, including the resources available to them, including our Aetna mobile app and our online tools to submit claims and more. Even during open enrollment, many of our members experienced the positive benefits of our mobile app because they were able, once they were registered, they were able to have their ID card and show it to providers. You can use that same app not just to view your ID card, but you can also use the app to submit claims more easily and efficiently into Aetna's system. It will also create faster turnaround times for members to be reimbursed. And also our online tools at Aetna.com. We encourage all of our members to register at Aetna.com, where they'll be able to use many of the similar features on the mobile app and more. Explanation of benefits always provides, an explanation of benefit always provides a reason why a claim is pended. So actually, let me take a step back. So explanation of benefits are forms it's a form that Aetna provides to each of our members at every time a claim is serviced, is processed in our system. So every time you go to the doctor and the doctor submits the claim, once the doctor submits the claim to Aetna, every time we will provide you what we call an explanation of benefit or an EOB. That EOB will provide you details on your service that you received at that provider. It'll also share details on how much did it cost, how much was allowed, how much did Aetna pay, and what is your possible balance remaining. If a claim is pended or denied, our explanation of benefit always provides a reason. So that reasoning will always appear towards the bottom to share more information with you. Next slide. Explanation and coordination of benefits is always something very difficult to understand, especially if you're not in the insurance arena. It can be very complicated for many members trying to make sense of all of it. So the challenge is understanding the explanation of benefit, but also understanding coordination of benefits, which is primary versus secondary coverage. So EOBs always provide a reason, I mentioned that. Often for example, Aetna is requesting verification of other insurance. So sometimes when you receive an EOB, there'll be a rather lengthy explanation stating that Aetna is asking you if you have any other insurance. We'd like to know about it before we process the claim in full. Sometimes it's easy when you look at an explanation, a benefit, and you see that it hasn't been paid, maybe the instant thought is that it's denied. It does not mean it's denied. It just means that Aetna just needs to know if you have other insurance to ensure that we're processing the claim correctly. If you see that statement, you may call our member service center, let them know, yes, I have other insurance and here are the details, or no, I don't have other insurance. And the representative will input that into the system and process the claim. If you do not respond to that inquiry after 45 days, the claim will be denied, but it doesn't mean that it's denied forever. If you get around to it later and you call member services, they'll reprocess the claim. Other examples include if a provider is out of network or if Aetna is waiting to receive additional records from a provider. Perhaps there's an issue with the CPT code. I mentioned earlier, if the CPT code that was used does not provide the diagnosis, we may pend the claim until we receive the right code or more information from that provider. Providers also receive a very similar letter as the member receives. It's also important for members to understand who their primary insurance carrier is. Example, Medicare. Next slide. So one way we help our members simplify this complicated process, especially when it comes to coordination of benefits, which insurance companies first, or receiving this EOB to submit a claim to that other insurance. Medicare Direct, how it helps our retirees, is it's a system linking their Medicare plan to their Aetna plan. So when a provider submits a claim to your primary Medicare plan, so let's example, Medicare is your primary plan, you go to the doctor, you show your Medicare ID card, the doctor will submit the claim to Medicare for processing. Behind the scenes, Medicare will push that claim directly to Aetna for processing because we've linked your Medicare plan and your Aetna plan together. We encourage many of our retirees who have Medicare to call our member service center, provide your Medicare information, and enroll into Medicare Direct. That's a great process because not only does it improve turnaround time, but it reduces many of the complexities of having to complete, wait for one EOB to come to then submit it to Aetna. It also improves turnaround times for providers because then they're also getting paid more quickly and efficiently. Next slide. So off-island care. We have, so since the implementation of the program, we learned quickly that the current off-island care, the process that we had at the time was not fitting for GovGuam. And we heard that from our members and we listened to them. We encouraged feedback from our members so we can learn which processes to continue to improve upon. So since the beginning of this year, we've established a direct contract with St. Luke's in the Philippines, where a majority of members go to receive care. We've established enhanced care experience model with Medical City as well. We've processed over, let's say, around 1,400 letters of authorizations for off-island care. We've hired dedicated staff in key facilities off-island to support our members. And we've established off-island care process in the U.S. mainland for opening up GovGuam to over 1 million providers that are contracted with Aetna. Next slide. So the off-island care, the challenge that we had was the lack of visibility into the off-island care requirements and just what members were used to experiencing before and what was right for them. Members having previously scheduled appointments that we were not aware of under the prior plan. So during implementation, many members had appointments scheduled that we encouraged them to advise us and let us know about so we can help intercept and provide updated letters of authorizations to the facility and to their providers that their care will be covered by Aetna. During open enrollment, we also expressed to many of our members that we were going to honor any letter of authorization that they had for scheduled appointments through the end of October. Appointments post-October 1 were being canceled without Aetna or the members' consent. That was a big frustration for many members that were visiting our office and our team during open enrollment, that their appointments were being canceled and that they were having difficulty rescheduling them and they needed their care. Those appointments were not canceled by Aetna, and we encouraged many members not to cancel their appointments, but to keep them because we are honoring their letters of authorizations. So we worked with our members, and we also built a database of all our members that were receiving care off-island. We also worked directly with local and off-island providers to ensure scheduled appointments were not canceled. So we were calling St. Luke's, Medical City, advising them, for example, Hassan Kraybani is there receiving care. Please do not discharge them. Please do not cancel their follow-up appointments. We hired staff at St. Luke's and Medical City to provide support to those members during their care off-island as well. Next slide. So the off-island process at St. Luke's, the original challenges that our members had experienced was a result of a vendor relationship in the Philippines. The members were experiencing longer than expected wait times with providers, as well as receiving their letters of authorizations. So between October and December, that was a big complaint by many of our members, was that it was taking too long to get that letter of authorization. And certainly, we helped many members who expressed their frustrations to us. But more importantly, as I mentioned, Aetna released a new process in partnership with St. Luke's and PhilMD to improve our member journey and the experience at St. Luke's. So Aetna and St. Luke's, again, are now direct contracted. We're not using the previous vendor for GovGuam at St. Luke's. Appointment scheduling supported by the International Patient Lounge. So all of our Aetna members now have access to the International Patient Lounge, or IPL. At the IPL, we also have dedicated staff to support GovGuam members. So hopefully soon you'll be seeing a banner that says, IPL welcomes GovGuam. Greater coordination between Aetna's our Aetna Guam office and PhilMD, because we don't want our members having to go back and forth between the Aetna office and PhilMD, as they're getting their LOA from our office or their travel arrangements made with PhilMD. So now today we provide them one packet. Here you go. You're ready to go off island. It includes everything for you. The IPL office in St. Luke's also has greater autonomy to provide letters of authorizations, which will expedite some of the waiting times that were complained about before. And then dedicated staff at IPL I mentioned to welcome GovGuam members.
If I could just, I'm sorry, very loud. If I could just interject. So I took a trip out in January to actually run through the process. I went a day early so that they wouldn't fabricate or make things look better than they actually were. So basically what we did, the International Patient Lounge is on the first floor. You're not required to go upstairs, up the elevators, and wait in line. We have dedicated staff there. We have dedicated GovGuam staff, and we actually have a manager. There is a manager at the IPL now that welcomes GovGuam members. Okay, that's very good. Now, if there are any issues, and I gotta let you guys know, this is not a once a week communication with me. I'm hands-on, I'm on the ground. I speak with the manager every day with all of our members. And if I don't get a response, or if we don't have satisfaction from our members, we have actually VP, Vice President level attention there at St. Luke's. And so I got to tell you, we've had several members that have traveled since January 1 and actually have been able to see the difference. And actually, our members are sophisticated members, our GovGuam members, and they deserve the best. And we've actually seen a huge jump in improvement and satisfaction, with our members. So just wanted to share that with you.
That's a great experience. Thank you, Frank. Great. So member services. We've trained over 50 member service representatives to support GovGuam 24/7, 365. We also have knowledgeable staff ready to assist you in person at our local office, which Frank oversees, and a great team there. And we also relaunched our mobile application, offering members convenient access to information on the go, including our website, which I'll speak to more about. Good.
Next slide. Next slide. So if you give me a moment, I just want to go ahead and introduce the Aetna GovGuam team. So my name again is Frank Ariola. I'm the Guam manager. Our receptionist is Tiffany Babalta. We have a wellness coordinator, Ariel Siswico. Off-island care coordinators, we actually have 2 CSRs that are dedicated to this, and it's Jackie Mesa and Lisa Lucero. Our customer service agents are Lena Rapola, Diana Tapashna, Danny White, Lori Rabi, and Nick Perez. And we have 2 nurse case managers, Z Unse and Ruth Sabangan. And we're really excited. We're just about to add a local medical director, and this medical director will be available to answer any of the calls from our local doctors and so forth. So we're very close to bringing this director on board. And I'm actually really excited because we're going to have a provider liaison here on Guam also. We get the support with Aetna International, but we're going to have somebody on the ground. Right now I spend about 80% of my time in the office working with members, and another 20% actually going and visiting providers when we have any issues, so I help facilitate. But we will be bringing in a provider liaison, which is good for our service to our members. Next slide.
So our member service center, one of the challenges that we've experienced with, during this time is members do not want to call off island. So with our local office and continue to provide training to our service representatives to be handled directly here on island, our member service center is available to our members 24/7, 365, and they can provide support to you about benefit questions, where to find care, access to our care team. So our care team includes accessing our case managers, our nurses that are on staff. Whether you have a question, maybe your kid is running a fever and you just need suggestions or help, they can provide you support. They can provide support with pre-trip planning and many other features that our members can utilize. So we certainly encourage that. And then also, if you have questions about your claims, maybe you received an explanation of benefit and you just don't know what it means and you're confused. You can call them. Average speed to answer is roughly anywhere between 10 and 25 seconds. Oh, I guess I'm getting ahead of myself. I have a next slide. Yeah, next slide. But some more fun stats about our member service center is, first call resolution, during October, November, December, specific to Gov Guam, is on a quarterly average of 96.06%. We took in a total of 12,202 calls last quarter, and 1,700 completed surveys. And of the 1,700 who completed surveys, we're seeing a 94.76 customer satisfaction rate. So we're very pleased by those results. We continue, again, as I mentioned before, we continue to train our member service representatives around the unique plan design and also just the unique dynamic about where members are going to receive care about Gov Guam. And that training continues to be successful. I think our members are experiencing it also. And then moving along to the next two slides, so additional resources. Our Aetna, I mentioned our Aetna Health registration, right? So we encourage all of our members, if they're able to, register on Aetna.com. It's and also AetnaInternational.com. It's a single sign-on platform. So once you register for one, you're registered for both, and then you can jump between the two. There's great features in there available for our members. They can print out temporary ID cards. So let's say they travel and they forget their ID card here at home. They can still access it on their phone or on the website. There's also great information pertaining to wellness benefits, details about their plan designs, etc. So year to date, ending 2019, so October, November, December, we had 2,200 subscribers registered, 7,600 logons, and then top features utilized during that time based off of those logons were explanation of benefits, as I mentioned, find a doctor, where to receive care, and then also ID card view and requesting new ID cards. Next slide. We also have, and hopefully many members are aware, but if you're not, please visit our Aetna Gov Guam website. The Aetna Gov Guam website is going to provide you with features about update to our office hours, holiday schedules, things like that. But also to explore wellness benefits. There's a wellness tab, and it will provide details about the wellness benefit provided to you by Aetna International. There's also great information there about managing diabetes and also details about your pharmacy benefits. We continue to update this slide for our members, and so I suspect that this will be growing every single week. So there's great information. Please take advantage of it. So moving along here, I just want to take just a brief moment to share some of the testimonials that we've received.
Thank you. So I'll start. All three that I'm going to be mentioning are actually from members, and we're not going to mention any names. My last experience was great. I had to go to the East Coast for follow-up treatment, and the facility is now in network when it wasn't before. Second member, I'm a Government of Guam retiree, and I'm able to use my health and dental insurance locally and abroad. Thank you, Aetna. Third, all the Government of Guam retirees I spoke with shared that they are paying approximately 60% less for prescription meds under the new healthcare insurance provider, Aetna. My daughter is in San Francisco, broke her ankle. I worked with the people at Aetna, and they coordinated her coverage. Everything was fine. She was able to get her prescription at CVS Pharmacy. I am giving high marks to Aetna at this time. Next, positive experience for medical attention off island. Medical records were sent and appointments were scheduled ahead of time. All went very smoothly and efficiently. We are grateful for Aetna, who took care of us even during the early days of their transition into the Government of Guam.
I really do not have any complaints with the services and prescription copays that I have encountered since the start of our coverage. On the contrary, I really would like to thank the negotiating team for listening to what the, quote, older employees and retirees were asking for. We needed coverage for diabetes, high blood pressure, and the ailments that come with age. While insured with Calvo's Select Care 2000, altogether my monthly payment for my medication was about $150. Currently, I went ahead and agreed to have Januvia included with my maintenance medications, and I do not even pay $40 a month for all 5 of my medications.
I have one lengthy one to share, and I won't read through the whole thing. I'm very impressed with Aetna's phenomenal outreaching contracted hospitals, clinics, rehabilitation programs, etc. worldwide. This is especially great in that we can now access a massive number of facilities and clinics in every state of the United States and as well as internationally. The likelihood that any Government of Guam active employee or retiree will be faced with a 30% out-of-network, non-contracted hospitals or clinics co-payment is slim to none. Our ability to access medical services with our loved ones' stateside residences, most in any jurisdiction off-island, is a great advantage from that burden, some expenses of the past just to be treated away from home, practically bankrupted many families with the exuberant housing and transportation expenses that could have been alleviated had a contracted hospital was in the nearest locale to relatives and family who openly would have assisted in staying with them. Thank you. Yeah. Okay, thank you. We touched on key service points and will continue to make improvements to enhance member experience. We thank you for your time and look forward to addressing your specific inquiries. Jesus Masi.
Thank you.
Thank you. And at this time, before I ask my colleagues to say anything, I first want to apologize for some of them who had to leave. There is a graduation going on that we needed to be at, but we thought that this was also very important. So some of our colleagues had to leave to that graduation. And at this time, I'm going to ask the government to say a few words. Mr. Ed Byrne from the Department of Administration, can you share some of your thoughts?
Thank you, Speaker. Good evening, Senators. My name is Edward Byrne, Director at the Department of Administration. The Government of Guam has a responsibility to procure a health insurance policy each year for its employees, retirees, and dependents. This is the largest single procurement which the government makes, and in value is about twice the amount of all the other purchases that the primary government makes annually. This is accomplished by a negotiating committee of 11 members working together to make a recommendation to the governor. This process is subject to the same regulations which guide all other procurements by GovGuam, and I would like to acknowledge the hard work which the members of the committee put into this process. Bidding carriers are scored for the content of their bids, and the winning score receives the committee's recommendation. Weighting of scoring factors varies, but the highest weighting is given to cost. For fiscal 20, the committee was tasked with recommending a single bidder unless a multiple carrier option produced a more economical result. I can tell you that the single carrier bids received were between 10 to 15% cheaper than the multiple carrier option. This makes sense since a carrier's administrative costs are recovered from a known and greater volume of subscribers than the alternative. Fiscal 20 was the first time that this theoretical savings was tested in the market. The result was as expected. As everyone knows, healthcare costs increase each year, and we have a responsibility as trustees of public funds to find the most cost-effective solution. In fiscal 20, the negotiating committee followed the law and did just that. The winning bidder was Aetna, and the committee made that recommendation to the governor. However, the path to that recommendation was not easy, As soon as the original date for submissions of bids was imminent, we received a protest which halted the entire process at the beginning of May. The renewal date of October 1st drew ever closer. The public auditor heard the protest and issued a decision on July 30th. The appellant immediately filed an appeal in Superior Court, which would have again halted the procurement process, but for the government filing of substantial interest findings so that the process could restart. We should have been well into the implementation of the enrollment process by that time. Again, I would like to acknowledge the hard work by all the parties involved to enroll a very large number of participants in a short time frame. The enrollment period necessarily extended beyond the start date of the policy, and all were fully engaged so that GovGuam members continued to receive uninterrupted medical attention and care. The appellant filed cases in both Superior Court and District Court. The Superior Court case has been generally resolved in the government's favour. The District Court case seeks to challenge the validity of Public Law 35-2, which mandated all public and private hospitals, except Naval Hospital, be included in the network of health insurers which provide coverage to GovGuam, and by extension seeks to overturn the Fiscal 20 contract which followed that statutory mandate. The overall goal of DOA is to ensure that the government receives value for money, the money is well spent, and that this process, which covers a significant proportion of the island's population, provides both quality health care to subscribers and stimulates medical providers to offer the broadest range and highest quality of medical care at a price which is acceptable to the government and ultimately the taxpayers. Health insurance is a benefit offered to government employees and retirees. When assessing compensation available to government employees, it is part of this package to recruit and retain the best people to work in and improve government processes. DOA, Human Resources Division, and in particular its Benefits Department, and its members are here tonight, are on the right there, which services not only the line agencies, but also the autonomous agencies in this regard, works to support the interests, including healthcare, of GovOne employees and retirees. However, it's important to recognize it's not the government that offers these services, but providers, and for the most part, we have a choice of providers. Providers are contracted with many insurers. The insurers receive information from medical providers, manage the service, and the flow of funds from the employer to these providers. A patient's primary contact, if there is disruption to this process, is with the insurer. Every employee and retiree is encouraged to take advantage of the wide range of customer service options which are offered by insurers and which are outlined in the bid, whether an on-island office or by phone service advice. This is a service which is being paid for, and government branches should not try and shadow it. This is made clear to bidders, successful and unsuccessful alike. The role of the government, once the contract is let, and the current contract is posted on the DOA website, is to make sure that the vendor carrier applies the provisions of that contract to all employees and members, since should they depart from that principle, it is likely that unexpected costs may arise, and as I indicated at the beginning of my presentation, ultimately the government will be called upon to bear the cost. Thank you for the opportunity to offer these remarks to this informational briefing. DOA is always happy to share information whenever it is possible to do so.
Thank you, Mr. Byrne. First of all, I want to thank my colleagues that are here with me and those that were here earlier who had to leave for another event I want to note for the record that I would like my colleagues to submit questions in writings to my office because I am very much aware that they too have received a lot of concerns of issue regarding this. And I'd like to state for the record again that we want to make sure that we protect the privacy of the patients. And that being said, just knowing that a lot of the challenges that were brought up and a lot of the solutions that were there, we know that there are other issues of concern that have been brought up to our concern, and we're going to make sure that we write that down. I do know that even the mayors, under several of them were here tonight, had concerns, and they have brought it up to our attention. And I guess this continues to go, as I'd like to say, it continues to be growing pains. I do know there's a lot of comparisons between prior policies versus what is existing today, what is usual, what is not usual. And from personal perspective, I must say that even having my own loved one go through a lot of trials and tribulations through the transition, it gave for a lot of heartache when I wasn't there to help facilitate it, and it got very, very, very difficult and frustrating. But with that being said, I also had an administrator from one of the government agencies called and talked about the non-responsiveness and the confusion of having to be directed to another phone number to get an assistance from off island, not here. I know that that was brought up in one of the solutions, that we have a Guam office and we have the numbers, and that someone from Guam will address the concerns that come up. I also want to share that as it relates to the pharmacy and pricing of medication, what was maybe cheaper in a previous policy is not the same. It was ranked up more than 100% or 10 times the amount. How does that compare? Those are issues that still need to be, I know there's negotiations that go on between vendors and the insurance company, but how does that affect the bottom dollar for our constituents? The other concern that came up and you brought again was about the billing, about the coverage that has been denied, and how does that work? You talked about the, it's not really denied, you just got to bring it in, let us look at it case by case. And I'm going to share, I want to share for the record that it is important that the listening audience and all those of you that are here and concerned about how this process goes along, each year the insurance negotiating team has to come to the table with, like what the Director Byrne has said, and has to negotiate for the best for the government of Guam and our retirees of the government of Guam. And things change, but in the meantime, we need to be able to tell our constituents and our patients out there that if there is a concern, that the provider will provide the proper information or take it on a case-by-case basis, because we are not the experts as policymakers. We are not the medical experts or the pharmacy experts, and you guys as providers need to facilitate that information moving forward. Again, I noted it for the record. I want to tell the people out there that we as policymakers continue to listen as leadership begins with listening, but this needs to be continued. That information awareness needs to be out there. I want to say that at this time, I want to thank my two colleagues who stayed here with me. I will ask again that my colleagues submit all their questions in writing. I will submit it to Edna, but if they'd like to comment before we close this evening, I'd open the floor. So to my Vice Chair, Senator Marsh, would you like a comment or a statement?
I'm good for now.
Okay. Minority Leader, Senator Tadegui, you're recognized for a comment.
Si tuas masi, Madam Chair, and good evening to everyone that's here today. I appreciate you being here and providing this lengthy informational briefing with regards to some of the challenges that you had. It was nice to know, and then what you did as far as solutions are concerned. You know, Madam Chair, I'm here as well by several constituents who've come to my office too and made some complaints about Aetna not getting their claims in time, or most especially when they try to make phone calls to Aetna and not getting answered. In fact, I even attempted to call Aetna myself several times, and with no luck. I even emailed. I got an email address, and I submitted that email address and still didn't get any response. You know, usually when constituents come to our office, you know, we listen to what they have to say, and then we try to do the same thing and try to go their route, you know, like secret agent, to see if it happens to us too. And it did. It happened to us. And I noticed that you said you had 75 individuals here working for Aetna. Is that true? In Guam? It says 75 here on your printout that you have 75 individuals.
Yes, so 75 people are supporting Gov Guam. That's on island and off island.
On island and off island.
island. Yeah,
How many people do
collectively,
you? Okay. Yeah.
So, on statement form, please.
Oh, to ask them these questions about
Yeah,
how many
yeah,
people work for the office?
Well, no, he was just, I just let him clarify that because it's in the presentation.
Oh, but it wasn't clear. I was
Yeah,
just
so that's why I'm saying
wondering.
it's just as a clarification on a statement that you noted. So you're reading through that, and it is 75 on and off island, am I right? Go ahead and state that for the record, just for clarification's sake.
Yes, so 75 people, just to clarify the presentation component that's already been addressed. 75 people supporting Gov Guam in total, on island and off island.
Can I ask how many's on island at Aetna right now?
Okay, I will go ahead and answer that. On the presentation as provided, you have the manager, which is Frank Ariola. You have the receptionist, the wellness coordinator, the OI coordinators, the customer service agents, and the nurse case managers. Am I right? Yeah.
And customer service, so that's a total of how many, Madam Chair? How many people?
4, 6, 8, 10, 12, 14.
So you have 14 people on island working Aetna to cover customer service. Well, of course, some of them are not customer service, taking the calls of individual insurers. How many, I just want to know how many answer phone calls?
Okay,
You know?
again, that is a valid question, but I'm going to ask that that be directed in writing, and so that you need to know that those questions should be answered because it will come in statement form. Please proceed,
Okay,
Minority
and
Leader, in
the only
statement
reason
form.
why I'm asking this question is I know there's people who are not able to make it here and want to know themselves and listen to these questions, so it's kind of hard for them to know, you know, what the answers are, you know, if it's not publicized, or, you know, for you to answer these questions. But anyways, you gave me that many people. For how many people are insured under the Government of Guam insurance program? Mr. Burns?
The
How many people are
total-
insured
the
under Government of
total,
Guam?
you know, it obviously varies from month to month, but there's about 26,000
26,000 insurers.
employees, retirees, and dependents.
Employees and retirees on the island. Okay.
Again, Senator Minority Leader, I'll go ahead and acknowledge that as a clarification point, because again, based on statement of information, if I can get that also in response to that, I will go ahead and include it in question form. Please proceed.
Yes, Speaker, certainly.
Well, I do have a question that was asked of me to ask from the Oversight Chair on Health. She's unable to make it. Senator Chalahi has her mother's rosary this evening, so she was unable to be here, but asked me to ask a question. But if I'm not having to ask any questions here, and it has to all be in writing, then I don't think I should even ask any questions. And just thank you guys for being here. So thank you, everyone, for being here, and looking forward to hearing the other testimonies then.
Thank you, Minority Leader. I think, ladies and gentlemen, it's really important to know, as we gave the opportunity for Edna to present and the government to share their perspective, and the listening audience who's also out there, all the issues of concerns. We wanted to make sure that presentations were made. If there is an issue of concern, we want to make sure that the government of Guam's provider provides an answer in writing so that everyone will have the questions answered by the provider. And as I noted in statement form, there were a lot of issues and questions that have come to me. I too will put that in writing, but I acknowledge several of the concerns that you brought up in the challenges, and then in your perspective from the solutions, for the solutions, but there is still more, and that we will get that in writing because of the interest of time. I want to take the time to thank everybody for being here. I do know that there's a representation from the doctors. I see Dr. Lizama, Dr. Nguyen, and Dr. Akimoto. Uncle Nasidu for being here. I see a lot of residents out here who know that this is very important to them. I'm hoping that the presentation that Edna gave, as committed to the people of Guam, that there's some answers, some solutions that were presented to us that would answer your inquiries. But again, and as I see some of those that are disappointed that some of their questions are not answered, I want to ask you personally to help me get those forms, write them down. If you need my office to help, we will do it. If the representatives from Aetna are out there wanting to seek your questions, you can share it with them. They can write it down for you. But I want the responses in the questions in writing back to the questions that is presented to Aetna, answers be provided in writing back to us so that the people can understand, because this will be shared with the public on all the questions. And that's why it was very important to say that, because if not, then we'd be here for the next several days. And again, I want to thank the mayors for also being here. And with that being said, it is 7:10. I will call this informational briefing adjourned. Sizu Asmasi, and thank you everybody for being here.